Hi, my name is Dr. Mike Hennings, board-certified chiropractic neurologist, practicing full-time in Palm City, Florida, and also Port St. Lucie, Florida. Talking today about cervicogenic headaches, which are a really common type of headache. They're very underappreciated, and they're one of many different types of headaches. So let's talk a minute about the different types of headaches that there are. The big one is migraines, which everybody's very familiar with. They're horrific headaches. They're very painful, more common in females than they are in males, usually start around adolescence and usually actually get quite a lot better at menopause because they are a hormonal endocrine headache. They are a vascular headache, and they're very difficult to treat. My experience is that chiropractors don't have as much success treating migraines as we do other types of headaches. They do respond well to medications. One of the things that chiropractors do have a lot of success with migraines is getting rid of the triggers. Unfortunately, one of the triggers for migraines is other types of headaches. So if you have a headache, say a muscle tension headache that gets pretty bad, what happens is that'll trigger a migraine, and then you actually do have a true full-blown migraine. And that's the type of headache where you're stuck in your bedroom and you turn the lights off and put a pillow over your head for a couple of hours until you go to sleep. Another type of headache is muscle tension headache, like we talked about. It's typically described as a band, like a headband going around the head. It is derived from muscle tension, like the name implies, and usually these headaches are reproducible by palpating the muscles that are irritating the head, and then the headache is reproduced briefly, and that's pretty diagnostic at that point. There's other types of headaches, like blood pressure headaches, for example, which are pretty self-explanatory. Blood pressure goes up or down, and that can cause a headache because of the change in pressure in and around the brain and the cerebrospinal fluid. Another type of headache is cluster headaches, which are very painful. They're actually pretty rare, more common in males than they are in females, and they are triggered by alcohol intake. They are triggered by actually taking a nap. Strangely enough, some people will wake up with a cluster headache. They're called cluster headaches because they happen in clusters. So they might happen for a couple of months at a time and then just go away spontaneously. And then you go another couple of years even, and then you get another cluster of headaches, very painful, for a couple of months. And then they go away spontaneously. Difficult to treat, difficult to diagnose actually, because they are sort of fleeting or transient. And they're actually fairly rare. So going back to the topic of the video, which is cervicogenic headaches. Cervicogenic means that the headache itself is derived from neck disorders of some sort. There really are no pain receptors in the head. So essentially what happens with cervicogenic headaches is the joints in the neck, or the discs in the neck, or the ligaments in the neck refer pain to the head. The brain perceives the pain as being in the head, but it's a referred pain. It's really no different than if we had a sciatica where the nerve is being irritated in the back. The brain perceives the pain as being in the leg, even though there's really nothing wrong with the leg. Another analogy is when a man has a heart attack. He has chest pain, but he also has arm pain. Really, there's nothing wrong with his arm. The brain's perception of where the arm is neurologically is linked very closely to where that problem is in the heart. The idea is if we fix a problem in the neck, then the headache should go away. And in fact, we know that based on research, cervicogenic headaches are really treatable, a very high success rate with chiropractic care treating cervicogenic headaches. And luckily, it's a fairly brief treatment plan typically. So what do we do for cervicogenic headaches? Well, essentially, if we restore the normal function of the neck, then the headache should go away. The normal function meaning range of motion, muscle tone. If we rehydrate discs that are causing problems, and that's a big one that causes cervicogenic headaches, that should help. Cervicogenic headaches may or may not be associated with vertigo as well, because disorders in the neck do cause vertigo. So that is a sometimes associated symptom with cervicogenic problems. So by normalizing the joint function, then we normalize the muscle tone, we normalize the nerve function, and that creates the headaches, or allows the headaches to go away. But what does that actually do? Well, essentially the adjustment, the chiropractic adjustment, normalizes range of motion. It breaks up scar tissue and it normalizes the proper function in the joints themselves. The manipulation causes an enkephalin release, which is a peptide that suppresses pain. Motion itself is actually pain suppressive, and it decreases inflammation. The inflammation is what causes a nerve irritation, so by normalizing the function in the neck, the nerve irritation goes down by way of reducing inflammation, and then we wind up with normal function. Essentially, the headache goes away. The idea is decreasing spasm, anti-inflammatory properties, and then ultimately the end goal is pain suppression by normalizing the function of the spine itself. If we were to take a look at the model about what that actually looks like, so let's see if we can get sort of a close-up here. This is the back of the neck, and these are the bumps there. You see kids walking down the beach, skinny kids, you see these bumps here. This is the spinous processes. In the neck itself, if this were the base of the skull, these joints, not a great shot here, these joints, the facet joints, cause a lot of irritation, and you can see further down, they overlap like shingles on a roof, top to bottom. So little by little, irritation in those joints causes referred pain, and that's another type of referred pain that goes to the head. It's called a sclerotogenous pain, a joint pain that refers directly to the head. So by resetting those joints so they're not rubbing on one another, that's another benefit of the chiropractic manipulation. So ultimately, what do we need to take home about cervicogenic headaches? They're very, very common, underappreciated, very treatable. And the way that we can identify a cervicogenic headache is some sort of movement of the neck causes a headache. In particular, what we'll do is we'll actually push down on the head to see if we can irritate the discs. And if we're able to irritate the discs that way and it causes a headache, that's pretty diagnostic at that point. Sometimes we'll actually pinch the muscles, because cervicogenic headaches are usually associated with some sort of muscle tension headache. So if we can irritate the muscles just a little bit in and around the neck and we cause a headache, well, that's pretty diagnostic at that point as well. There are other diagnostic measures. One is a facet injection, or the other is an epidural steroid injection, that are injections that go into the spine or at the outer part of the spine, not into the spinal cord. But those are diagnostic injections. If they work, then the headache goes away, and that's your answer. And sometimes, unfortunately, that's something that needs to be done. So the treatment, again, we talked about being very successful for cervicogenic headaches. There's one paper that I like to reference, and it comes from Journal of Manipulative and Physical Therapeutics, and it came out in 2004, and the journal article said that somewhere between 9 and 12 visits, and we saw total resolution of all the participants in this study with their cervicogenic headaches with chiropractic care. So really very successful. Lastly, we'll just talk about the office. We'd love to have you stop by if you're available. The office is located in Palm City, Florida. You can always hit us on Facebook at Hennings Chiropractic Neurology. The website is henningschiro.com, and the phone number is 772-486-7427. If you're in Palm City or Port St. Lucie, come on by and say hello. Otherwise, good health. We'll see you later. Thanks.